Good afternoon, everyone. Happy Monday. I hope this video finds you well, that you took advantage, at least for a little while, of the nice weather that we had this past weekend. Right now on Monday afternoon, I'm experiencing a lot of rain here in Chilton, and I know you guys in Sheboygan and other places are also. And one can say at least it's not snow, and that's a good thing. Now I want to use that as a segue into the topic of this week's video. The video today, I want to talk about the word empathy. And as you know, to empathize is the ability to understand or share in the feelings of another. So when I go in and see a patient in the hospital for the first time, I do what's called a spiritual assessment. Now, you don't need to know exactly what that is, but do know that there is a piece of that assessment is where what I determine what the patient's coping strategies are. What helps them cope? And when I first started doing this, I started hearing some strange things. Sometimes people would say, well, what helps me cope is that knowing that other people have it worse than I do. Okay, but I was bothered by that for a little bit, thinking, well, okay, but what about your situation? How bad is it? Or what are you doing to help cope with it? But as I thought about it, that really is a legitimate way of coping, is knowing that other people have it worse than you do. It's sort of a roundabout way of counting your blessings. Well, at least I don't have this or this, whatever the case may be. So I think that could be a legitimate coping strategy. We like to compare ourselves to others oftentimes. Maybe we will say, maybe in our situation, well, at least I'm not dealing with this, or at least I don't have this health problem like this other person does. We like to compare. Maybe if we're standing in a long line, we can say, well, at least I'm not at the end of the line like that poor schmuck is back there. So we like to compare ourselves. There is a dark side to that, however. And the dark side is this: when we compare ourselves to others, other situation, and especially when we perceive our situation to be worse than others, that's where we lack empathy. And we have a hard time showing compassion or empathy to someone that we think is their situation isn't near as bad as ours. Let me give you a story. This is what I did. Happened about 18 years ago. I was pastor of a church out near D.C. I just moved there. A little bit of backstory. About 4 months prior to moving to Maryland, my youngest daughter, who was 18 months at the time, just went through a 19-hour surgery, and then a month later she went through a kidney transplant. So it was pretty scary. That was difficult. And then we moved. And so I remember one of the first calls that I received from a woman at the church. She was a new mom, and she was frantic. She was really scared, crying, and nervous because she just found out that her 2-year-old son needed tubes in his ears. And she wanted me to be at the hospital with her when he had that surgery of the tubes in his ears. Now, if you can imagine, I was thinking, really, lady? You're concerned about tubes? When I just went through all this with my youngest daughter. Now, thankfully, I had enough smarts about me not to share that with her, not to tell that with her. But she was really frantic that her son was going to have tubes in his ears. I had a hard time showing empathy or compassion to this lady because of what she was going through. I perceived my situation to be worse. That's changed me. That situation changed me. You see, when I perceived that my situation was worse, I was having a hard time showing empathy towards her. And I think we can get that amongst our fellow caregivers, or maybe if we see patients in the hospital, when we perceive their situation to be not as bad as ours, then we can't show empathy. But if we understand, we try to put ourselves in their situation. Maybe they're in the hospital for the first time, or maybe they're scared about being in the hospital and catching COVID-19 with all these sick people. There is something that they're scared of. And if we put ourselves in their mindset, we'll find it easier to show compassion and empathy towards them. Or maybe fellow caregivers, when we perceive that our situation is a whole lot worse than theirs, we have a hard time showing compassion and empathy towards them. But if we put ourselves in their mindset, maybe they didn't go through something like this, and they're having a hard time coping. And I think that's an important piece for us to remember as caregivers, to put ourselves in their shoes. Till next time, stay out of trouble, and I'll see you next Monday. And God bless you.